Hey everyone, so in this video I'm going to go over some more strategies to help overcome or manage any type of knee pain that you may be having. So I know I made a video before, you can definitely check that out, but here are going to be some other strategies that you can start to consider if the first video didn't help you or if you still need some more help with that. So let's jump into it. So the first thing that we can do is look at the roller and use it as a tool to help relax our calf muscle here. And the reason why we're looking at the calf muscle is because it ends up connecting right behind the kneecap, and if it is tight, not only can it yank on that joint, but what happens is that it usually ends up tilting our body in a forward position, which just ends up putting more pressure on the calf. So we can start by putting both legs on there. We can lift the hips up and just kind of roll up and down. Now sometimes if that doesn't kind of get it good enough, then we can do one leg at a time. So just crossing one leg over, and then we can just, same thing, pick the hips up a little bit and just kind of rub or roll our calf over this foam roller here. And just like most things with the foam roller, we're going to look for some type of tender spot, some tight spot, and just kind of hold it there. And just try to get that area to relax, or that knot to kind of relax. So that's the first thing that we can do to help with our knee pain, using the roller to see if there's an issue with our calf. So the next thing that we can look at is opening up the hip flexor muscles to see if there's any issue there. So the hip flexor, there's a lot of different hip flexor muscles, but essentially those are going to be the muscles that kind of overlap this hip joint here and just cause this leg or this hip to kind of come into flexion, which is essentially where this leg is at right now, just bringing this knee up. So what we can do here, I just fall into this position here on this knee. What we're going to try to do is kind of squeeze this butt forward. This becomes a little bit more of an active stretch, just trying to get this glute on as well. Driving that hip forward as opposed to just kind of falling over here. We're going to drive that hip forward by squeezing the butt. Looking on this side here, we're not just going to collapse here, we're just going to squeeze the butt and drive that hip forward. Now sometimes this position may hurt people's knees, or if their knees are too tight or anything, this position could bother them. So what you can do here is just fall into this position here and just drop that hip down. Same thing, you can try to squeeze the butt as you get into that position, but this position usually helps take some of that tension off the knee. So again, another stretch that can help to see if there's any hip flexor issues. A lot of these muscles over here, this quad muscle over here, ends up overlapping with the hip. Same thing, if we have tight hip flexor muscles, what's going to happen is it's going to tilt our hips, put us in a forward position, and put a lot of stress on our knees. So this is a great stretch that you can do to help with any type of knee issues. And lastly, another exercise that we can do is a single leg curl with a band. So setting this band up to some type of anchor, we're going to put one foot in the band, and we're just going to end up laying on our stomach. And we're just going to end up bringing that heel to the butt. And you'll end up feeling this, ideally, in the hamstring. You may end up seeing that you have one hamstring, you feel it more on one hamstring than the other. A great sign that we may have one hamstring that's underactive than the other. So sometimes when you have that knee pain, it could be an issue of too much quad activation or a lot of other issues, but just we may have overactive muscles kind of in the forward front of our body. So these muscles in the back of the body, or in this case the hamstring, may be a little bit underactive. So you may realize that that pain that you feel on the knee, or let's say if it's on the left side, that left hamstring may be may feel weaker than the right hamstring. So I hope this exercise helps you a little bit on isolating that hamstring a little bit, but a great exercise that you can do to help you with that. So those are some exercises that you can do to help overcome or manage any type of discomfort or pain that you have in your knee. Again, when it comes to pain, there's many different reasons why it happens. So the big thing is to first figure out what's causing that issue, whether it's muscular or structural or anything like that, and then from there figuring out how we can progress in terms of movement or biomechanics or anything like that. So it's a first step. If you're still having issues with knee pain and it's just getting worse or anything, definitely try to get it assessed by some type of professional. But if you have any other questions, just let me know and I'll be glad to answer them.